San Fernando Valley, 87 today. It was 103 the other day, so this is an improvement. And a light breeze up to 7 to 10 miles an hour. That'll knock some leaves off the trees. 100 degrees as we hit Friday. That's a look at your 7-day forecast.
Thanks so much, Chris. A recent report by the Centers for Disease Control and Prevention is proving more evidence of how heroin use is devastating entire families and communities. It's providing evidence that the spikes are happening among women, young adults, and the wealthy.
Surgeon scientist Dr. Jandial here to discuss how prescription painkillers are cutting an even wider pathway to heroin. Welcome.
Hi, good morning.
So, what are the numbers from the CDC, first of all?
Well, a lot of things have doubled. They looked over the last 10 years, 100% increase in women, 100% increase in people 18 to 25, and also an increase in people who are considered affluent. So it's a blip on the radar, and think of it that if right outside on Sunset, if you had double the amount of car accidents, even if the raw number wasn't high, you would take notice. So we have specialists called epidemiologists that study trends, and they've noticed doubling over the last decade.
Well, we hear some say that with the prescription drug problem, that the pipeline was just chopped. I mean, people who were addicted to these painkillers couldn't get them anymore, and that some of them are now turning to heroin. Are you finding that as the reason, or what are doctors saying?
So when you think about drug use, whether your doctor writes for it or whether you get it on the streets or not, you have to think of categories. So cocaine, methamphetamines, these are stimulants. Narcotics, whether it's OxyContin or Vicodin or heroin or morphine, they all work in a similar way. So if you have knee surgery but you don't completely heal and your doctor gives you a limited amount of Vicodin, at some point you may become dependent on that and not be allowed to have that by us. So that has turned into how do I address that addiction? How do I address that pain?
Is it because of the opiate correlation?
Well, they're all under the same category, exactly. So the narcotics create a certain addiction, and your desire is for any type. And the easiest and the cheapest one to get once your doctor doesn't give you Vicodin is heroin off the street. And that's been the pathway, as you mentioned.
And the numbers suggest that people are using not just heroin or just painkillers. There's multiple drugs.
And that's the issue, exactly. Polypharmacy. You say, well, I'm on Vicodin. It's not working as well because we do get desensitized to it. That's biologically designed. Then you add something else in. And all narcotics, the major risk with them is respiratory depression. So that means at some point, usually we breathe about 20 times a minute. It can just go down to about 8 times a minute, and then it can just go to 2 times a minute. So you don't even notice that, and when you're taking all of these pills, you're seeing a spike also in overdoses because of that.
Well, how can doctors tell? I mean, some people say they're getting sent home from surgery with not enough, like they have an ibuprofen or something when they needed some painkillers, but then some go in complaining of pain and there's nothing wrong with them. They really don't need them. How do you doctors differentiate between the two?
Well, let's dig into that a little bit. I'm literally taking training on computers at City of Hope about pain management. So pain is a vital sign, blood pressure, heart rate. Well, how's your pain level today? Every patient has to be asked that. And if they say they're in pain, we have to have a plan for that. But there is no test I can perform. So if somebody comes in and says, I work a lot on computers, I've got horrible neck and arm pain. We have to address that. And in the past, we weren't treating it enough. Underserved communities were getting medicine. So we have become a little bit liberal with giving pain medicines appropriately, but now we're seeing the secondary effect of what happens when we do that. So it's always a flux. Not enough pain pills, people are saying they're suffering. We prescribe more, they transition to a little bit more illicit heroin use. So we're trying to figure that out, but pain has to be treated.
Is there anything that as either a patient or a family member of a patient who is going through some sort of traumatic surgery that requires pain medication that we can do to sort of make sure that they don't sort of go too far? Excellent
question, and here's the takeaway that I work with my patients. First month after surgery, you're supposed to hurt. This is not the time to turn down the pills. On your 3-month visit, if you're still taking the same number of pills as before, then I have to start paying attention, and so does your family. I think that's a great point.
Okay, great. All right, for more information about this topic and other health stories, go to ktla.com/Dr. Jandial. Thanks for coming. Coming up, it was a stunning confession from an Olympic athlete.
Susie Faber-Hamilton will join us live to talk about her double life as a track superstar and